Thank you so much for joining us today. We're so excited to have you here.
Thank you for having me.
Of course. And then, so can you go ahead and give us a brief introduction?
Mhm. So my name is Paige Bence. I am a board certified family nurse practitioner, and I work at St. Francis Hospital, primarily in the wound care area. And I've been here for probably 12 years or so.
Perfect. So have you all been in the wound care part all 12 years?
No, well, yes, in wound care here for 12 years. When I first became a nurse, I worked in the operating room. And so I actually spent 20 years in the operating room, some at Piedmont Regional and then some at Doctor's Hospital. And then I decided to leave there and been at wound care ever since.
That's awesome. So that, okay, so I'm sorry. I'm just excited. So what type of education or training is required for your career as a nurse practitioner?
So as a nurse practitioner, before you go to nurse practitioner school, it's a requirement to have 4 years of a nursing degree. So you have a bachelor's degree in nursing. Then you go for an extra 2 years and you obtain your master's in nursing. And one of the fields that you can choose while you're obtaining that master's degree is to become a family nurse practitioner.
Oh,
So
awesome.
it's actually 6 years of nursing school.
Perfect. So I love that you said that those degrees build on each other. Perfect.
Absolutely.
So with that being said, where did you go for a nurse practitioner school?
I went to Columbus State University and obtained my nurse practitioner.
Awesome. And that's a master's, correct?
Yes.
Perfect. So where did you go for your bachelor's degree?
My bachelor's degree was obtained at Troy University. My associate's degree was obtained at CVCC.
Oh.
And then my associate's degree was at CVCC. And before that, I even obtained an LPN from Columbus Tech. So I've been to many different schools to, like you say, and layer on top of layer. That's in nursing, that's one of the great things that you can do. You can always obtain more education, and it's encouraged.
That's perfect. And so you said an LPN from Columbus Tech. What is an LPN exactly?
So an LPN is a licensed practical nurse. It's usually with a diploma degree. So usually around 15 months, from a year to 15 months to obtain. But the difference between an LPN and an RN, there are certain skill levels that you're taught between LPN and RN school. Most LPNs will go on to obtain their RN degree, their registered nurse degree.
Perfect. And so that's awesome. I'm glad you said that because we've been talking about different certificates and then associates, bachelor's, master's. So thank you so much. So what led you to this career?
I think I always knew that I wanted to be in healthcare. I truly love helping take care of people. From working in the operating room, from the days of working in the OR, I would see patients for a very short time span, and I would get to meet them and I would learn a little bit about what their problems were. But then once you operate on them, they were gone. So you never got to find out exactly how they healed, what happened afterwards, things like that. So that is one good thing with wound care, is that I get to know my patients. I have a clinic where I have a set number of patients, and usually the same patients coming in week after week. And you just get to know them. They become part of your family, and your patients know that you care about them, what happens, and you want them to heal.
That's beautiful. Just seeing that evolution of them healing and wound care. Awesome. So what does a typical day consist of in your career?
I usually start my days about 7:30 every morning. There are certain days of the week that I am in St. Francis Hospital seeing patients, which is where I am today in our wound care office. We see patients that are in the hospital that have been admitted, and they may have pressure injuries. They may have had surgery and the surgeons are asking for our help to help manage these wounds. And then Tuesday, Wednesdays, and Thursdays, I have a clinic that of my patients that come in and see me. So my day is, like I say, Monday through Friday. We don't do weekends, holidays, or nights. That's the good thing with nursing. There are so many varied areas that you can go into and so many different time spans that you can work. But my day is pretty typical.
That's beautiful. So one of the things I want to ask, can you go ahead and explain more to our kids what wound care is?
Mm-hmm. So the wounds that I usually see are considered chronic wounds. These are wounds that have been present for 4 weeks or longer. Or if you have a wound that really hasn't healed, you may have, I see patients that have been in accidents. I saw a lady that got run over by her car last week, and so she had a wound on her leg. I see patients that spend a lot of time in the bed, and so they develop pressure injuries. I see patients that have had surgery and they need help after surgery to get their wounds to close. We are doing debridements on these patients, meaning we're helping them to keep clean, to help with the dressings. We manage home health care, which is another area of nursing that you can go into. We're just helping to heal these wounds. We're trying to get these patients. There is a lot of education that goes in with wound care, as far as a lot of our patients are diabetic. We try to teach some diabetes management, some healthy choices with diet and exercise. It's just a lot of education that go into this as well.
Perfect. So what do you enjoy most about your career?
Like I said, I love helping people, but it makes such a world of difference when you enjoy what you do and you enjoy the people that you do it with. We have such an amazing group of people on the outpatient side and the inpatient side. And it's just so refreshing when you don't mind get up coming to work every single day. You know, you've heard the saying that when you enjoy what you do, it's really not a job. And I thoroughly enjoy my job.
That's awesome. And I'm so glad that you said that, because we've been talking to the kids about turning their passions and their interests into like careers, because like you said, it doesn't feel like you're getting up and going to work every day. It feels like, yes, it might be slow rolling and getting up and getting out, but once you get there, you're excited about being there.
That's right. That is exactly right.
Awesome. So what are some challenges that you faced in your role?
In my role, I would say some of the patients that don't really want to listen can be a challenge. As you say, there's a lot of education. Some patients are not as receptive, and a lot of patients don't have the means to do what you're asking them to. So insurance is a challenge a little bit, trying to manage with patients certain insurance. But I will tell you that a big inpatient challenge that I've seen in St. Francis in the last 2 years is COVID. There's a lot of people that are coming into our hospitals, and our hospital nurses are maybe a little stretched, a little thin, and everyone's getting tired. But again, those nurses feel the exact same way I do. When you love taking care of people and you love getting up, coming to work every day, you do what needs to be done.
Yes.
But COVID has been a challenge.
Mm-hmm. Yes, ma'am. So how do you see your career evolving in the next 10 years?
Well, considering my age, I'm hoping that it pretty much stays about the same. So I actually did not obtain my nurse practitioners until about 7 years ago. So I was older when I went back to school, which one thing that everyone who knows me will tell you, I'm a huge advocate for education. There is never a time to stop bettering yourself, to stop learning. I do try to obtain certifications in different areas. I'm a specialized nurse in the operating room. I'm a specialized nurse in hyperbarics. I'm a specialized, certified family nurse practitioner, which family nurse practitioners, I can see a child as new as a couple of hours old up until the elderly and our parents and our grandparents and things like that. So I can see a wide range of age groups. But in the next 10 years, honestly, I hope to be doing the exact same thing that I'm doing now.
That's perfect. So what kind of person do you think is most successful in your field?
Those people, it's kind of a twofold. You need to be able in nursing to be autonomous and be able to work on your own. But then you also need to be able to work well with others and work in groups. In nursing, you are dependent on so many other groups of people. You work with x-ray people, you work with respiratory therapy, you work with physical therapy. There's so many other areas within the hospital that you're working together to try to get the patients to heal. But so you have to be able to, you got to be a self-starter and ready to get out there and get going and not be shy about it.
Perfect. So what does communication look like in your field?
Well, so there's a lot of people going into, electronics and computers and IT. The charting is usually on computers now, but the number one thing in healthcare, you've got to have those hands-off communication, which means that if I have a patient and I'm taking care of a patient, before I give you my patient or turn my patient over to you, I want to speak to you and look you in the eyes, and so that everyone is on the same page with what's the next step for that patient is going to be. So both computer and in nursing, we have a saying that if it's not charted, it wasn't done. So you have to chart every single thing that you're doing for your patients.
I love it. So what kind of technology do you use in your field?
Technology in healthcare changes almost daily. Like I said, with the charting on the computer, so there's that technology. There was a lot of it in the operating room with laparoscopic procedures.
What's laparoscopic?
Laparoscopic is when they can take a tiny camera and insert it into, say, if you're going to have a patient has a gallbladder removed or your appendix removed, which is very common. They used to have to make incisions several, inches wide in order to do the surgery. Now they're making tiny little incisions, and they'll put the tiny camera and the tiny instruments in there, and they're able to do the surgery much quicker, and patients just aren't staying in the hospital the length of time. When I was young, my father had his gallbladder removed, and he was in the hospital for 7 or 8 days, I think, back then. Now you can have your gallbladder removed or your appendix, and you'll be home by supper time. I mean, it's an inpatient and outpatient deal, thanks to the laparoscopies and the laparoscopic procedures.
That's perfect. So then instead of them doing a big cut, they do a small cut. I love it.
A smaller one. And so people are they're so much happier with it.
Yes. Perfect. And I'm sorry to cut you off because I just want to make sure, because our kids know, the big words, because I know y'all have a lot of big words and a lot of abbreviations.
Perfect.
So what kind of classes would you recommend for a middle school or a high school student to take if they're interested in your career or one similar?
So actually, I've also taught at Columbus Tech, and I taught in the health sciences area. One of the classes that I taught was to seniors in high school. They took a health science class, and either I would go to that school to teach them, or they would come to Columbus Tech weekly for the class. Anything that is in health science related, science is really important with healthcare, just the understanding of the body and how things work. And math is also very important when you're dealing with medications and drug calculations and things like that. You definitely have to kind of know your stuff in those areas, but anything health science related is definitely a plus.
That's perfect. And that's a perfect little plug because some of our students are going into high school soon. So they can go ahead and sign up for those CTAE courses and slide in and see if they're interested in it, because at this time, this is the time to explore and to find out what you're interested in, because if you figure out you faint when you see blood or anything like that, it's good. It's good to know while you're in high school, while you're not paying for tuition and stuff.
That's right. That's right. And with a lot of those classes, with when you take those in high school, then it counts as credits towards college credits. I taught some seniors in high school. By the time they graduated high school, they were also certified nursing assistants. So they went straight into the healthcare field. Several of my students that I taught back then, one of them is a nurse practitioner here at St. Francis now. Several of them have gone on and gotten their bachelor's degree in nursing. So again, I'm always about stressing the importance of education and moving forward.
Yes, that's so awesome. So do you have any other advice for our students here at Richards? I know you have a special interest at Richards, but do you have any advice for our students?
I say just keep your chin up, keep trying, keep plugging away. You may not be great at science or math, but that certainly does not mean you would not make a good healthcare provider. If it's something that you're passionate about, if it's something that you're truly interested in, don't stop. We talked about the LPN program. A lot of people go to LPN school because you can kind of get in and get out quickly and start making that money while you're working and you're trying to figure out if nursing is actually where you want to be or healthcare is where you want to be. Then you can still work and continue on, and it's just a great field to be in. You will always find a job in healthcare.
Beautiful. Thank you so much for your time.
Thank you so much. I appreciate y'all having me.